Okay, so for the last video, we're going to be going over shock. So when I first walk up to the scene, I'm going to want to make sure to control any severe bleeding, any life-threatening injuries that I see on the patient. I'm going to want to ensure an open airway breathing. I also want to do a primary assessment. So when I walk up to the patient, let's say they're unconscious and bleeding with some broken bones in their lower portion of their body. So going over a primary assessment again, I'm going to walk up to the patient, tilt their head back, chin up, check for breathing and a pulse at the same time. For this, it seems like the patient is still breathing, but unconscious because of the shock she just went through of the lower injury she just sustained to her body. So after getting through that, I'm going to want to call for more advanced personnel to get on the scene to help us with this situation and patient. But until they get here, I want to stay with the patient and make sure that they're okay and do everything in my power to make sure that they're all right before, let's say, EMTs get here. So if I'm unsure about what's going on, I'm going to want to leave the patient in a supine position, which is like this, laying flat on their back, leg all the way down, and making sure that they're all okay. If the patient is awake, I want to make sure that if they ask for food, I don't want to give them any food or water, because that could intervene with what the EMTs need to do once they get to the scene. I also want to immobilize and also I want to immobilize any suspected broken bones and make sure that the patient's not moving them and making them any worse. And I also want to make sure that I'm maintaining the patient's body temperature as a normal status. That can either be done by adding blankets over the patient or adding blankets under the patient to make sure that their body stays at the right body temperature while we're waiting for more personnel to show up. I also want to be talking to the patient the entire time, reassuring them, making sure they're calm, and letting them know that help is on the way, or advanced help is on the way to give them the treatment that they need. And I also want to treat any specific injuries or conditions and have the transpatient. I want to treat any injuries that I can at the moment, and also make sure that the patient gets transported to a hospital when the time arises and we can get them there safely. And we can end it.